The Covid-19 pandemic has arrived with a vengeance. It has changed our lives around the world. During this period, I don't know if you feel that our lives are under constant surveillance. It's an attempt to observe us through mobile devices that depend on collecting and analyzing extensive personal data. We must admit, surveillance is arguably one of the most excellent helpers during COVID-19. Federal, state, and local governments increasingly contemplate big tech and mass surveillance as a tool to combat the spread of the deadly virus. For the government, surveillance can help related professionals to support various decisions during the epidemic. Especially in the early stages of the epidemic, the collected data can provide information for designing and implementing effective public health measures. The government and researchers have paid particular attention to networks. They primarily observe and monitor healthcare-related websites, social media, and news reports, because the data they get through these channels can help them understand the spreading of a pandemic regarding healthcare thinking behaviors and health resources utilization. Additionally, for the public, surveillance has made great contributions to people's life quality and health. It provides useful and valuable new health surveillance technologies that are able to parse people's digital footprints, identify potentially infected people, and trace their contacts. Coronavirus Watch is one of the authoritative tracking websites. It publishes real-time coverage of COVID-19 in different countries, as well as confirmed cases and deaths in individual countries, giving everyone access to detailed data from around the world. Of course, the health code in China frequently used during COVID-19 is undoubtedly one of the typical surveillance application cases. Citizens show their QR codes every time when they enter a public place, and the different colors are used to indicate different status. Green means no risk, yellow means having been to potential infection sites, and red means having been infected. It also could allow citizens to check whether they have crossed the path with anyone infected and whether they need to self-isolate. Many countries have similar procedures, and they have been well received by their citizens. And about this, I intercepted interviews with South Korean citizens.
Overall betterment of society and just like for safety purposes, and I kind of want this corona to be over and done with, so I would rather do that than just deal with this forever.
As much as this surveillance might seem like a smart way to fight the pandemic, these programs can get it wrong. It has serious security problems of privacy disclosure. There has even been mass theft of information during the pandemic. This kind of information theft has seriously affected the physical and mental health of
computers on the University of Vermont Medical Center's IT network. In June, a ransomware attack forced Toronto's Humber River Hospital to declare a code gray loss of essential services. More recently, a cyber attack on Newfoundland and Labrador's Health Network data center resulted in the cancellation of thousands of medical appointments. And just last week, Headwaters Healthcare Center in Orangeville, Ontario announced its system had been breached.
Moreover, there is a profound risk that these types of artificial intelligence systems will mirror the prejudice, targeting marginalized groups. I interviewed my grandfather about his feelings about the use of health code during the COVID-19. The health code is actually good, but it has a fly in the ointment that some elderly people cannot master the use of these functions. The health code is the passport for Chinese people to enter and exit all public places, which means that mobile devices must be indispensable in daily life. However, many elderly people don't have mobile phones, let alone complex operations, which leads to their travel pressure. In conclusion, surveillance has two sides, so its positive and negative effects are worth pondering.